Welcome to the Certificate Awards ceremony for the Pancap University of Washington Clinical Management of HIV course. It is really a pleasure to see you in person. I know that when we were planning and deciding how we will hand over the certificates, especially working in a COVID-19 environment, we didn't think that we could have it in person. And so it's really refreshing to see that we're able to gather back again in person in small numbers, and it's good that we can have you with us this afternoon. I would like to recognize the presence of Dr. Douglas Slater, Assistant Secretary General of the Directorate of Human and Social Development, CARICOM Secretariat, under which the Pancap Coordinating Unit falls. Her Excellency Sarah Lynch, Ambassador of the United States to the Cooperative Republic of Guyana, Dr. Frank Anthony, Minister of Health of Guyana, Ms. Alana Shuri, representative from USAID to the Eastern and Southern Caribbean Office, Dr. Tariq Jagnaroin, who is the Program Manager, National AIDS Program Secretariat, Ministry of Health of Guyana, the staff of the Pancap Coordinating Unit, the staff from the Ministry of Health and the CARICOM Secretariat, participants / graduates, because you're graduating today, the media, and other invited guests. Over 3 months from April to June 2021, Pancap partnered with the University of Washington to roll out the Clinical Management of HIV course. This course provided a global perspective on the diagnosis and clinical management of HIV. As we all know, HIV continues to be a public health concern in the region and right here in Guyana as well. At the end of 2020, 82% of people living with HIV in the region were diagnosed. 2/3, 67% of all people living with HIV were on treatment, and 59% were virally suppressed. This highlights that there are still significant gaps to get us to the 2030 agenda of ending AIDS in the Caribbean. For us to get back on track to end AIDS by 2030, Caribbean countries must step up the pace around prevention, testing, treatment, care, and ending stigma and discrimination. This is going to require a doubling up of efforts, requiring us to ensure the continuity of services in a very disrupted environment, while at the same time accelerating progress around the elimination goals. We cannot advance the work of HIV unless we have human resources to support and to sustain national programs. Pancap has been working with national programs, civil society organizations, people living with and impacted by HIV, and other stakeholders to build capacity to support the continuity of care and to strengthen national and regional responses. Through the support of USAID, we've partnered with the Ministry of Health of Guyana to implement this important training course. Participants were able to learn from experts in the field who provided real-world examples of diagnosis and treating HIV and STIs in both resource-rich and resource-constrained environments. Participants were also able to share their experiences from the field and were exposed to new and innovative approaches in the management of HIV. A total of 18 participants were selected to participate in this course. Participants were drawn from the Ministry of Health, from the private institutions, from CSOs who work in the field of HIV. I am pleased to report that we had a 100% completion rate, with participants also passing with very high grades. Implementing this capacity building training during COVID-19 was challenging, but the coordinators and the participants made use of the various virtual platforms to ensure that site sessions were conducted, and a WhatsApp group was set up to ensure information sharing and coordination among the participants. We are proud of your achievements, and we ask that you use the knowledge and the skills gained from the training to further strengthen the national response and to improve the lives of those that we serve. Participants and coordinators will receive a high-quality certificate of completion on vellum paper bearing the official University of Washington seal, participants are also eligible for continuing medical education credits. So those of you who are concerned about receiving CME credits, you will receive 12 CMEs credit for participating in this training. I would again like to thank all of you for participating and supporting this important initiative. Special thanks to USAID, an important partner of Pancap, who has been with Pancap over the years and continue to support the program that we do. The Ministry of Health of Guyana that we work closely with in implementing various HIV initiatives, and the CARICOM Secretariat for the ongoing support and ensuring that HIV remains an area of priority on the regional development agenda. Thanks for being here today, and we recognize and we celebrate the successful completion of this course. At this time, I would like to invite Dr. Tariq Jagnarayan, who is the Program Manager from the National AIDS Program Secretariat, the Ministry of Health, to bring a few remarks. Tariq, welcome.
Good afternoon, everyone. All protocols observed. It is a great pleasure to be part of this such wonderful esteemed group, not only of high caliber dignitaries, but you, the cohorts and graduates of the Clinical Management of HIV course offered by the University of Washington through Pancap and the Ministry of Health with aid from USAID. The National AIDS Program is now in a better situation and equipped with healthcare workers not only to provide best practice evidence-based medicine as it relates to HIV and STIs throughout the country, but also to offer differentiated services of care to persons living with HIV, especially our key population and vulnerable groups. Noteworthy of this course, yes, I was a participant, is that it not only focused on adult HIV care, but we had detailed and lengthy information as it relates to pediatric HIV care, prevention of mother-to-child transmission, sexually transmitted diseases, including Hep B and C, new line regimen and therapeutic approaches, investigational therapies, PrEP and PEP, among others. Added to this course was not only offered to doctors of the public health system, but also it included members of the private sector and CSOs. With that said, I would like to take this opportunity to thank Pancap, as well as the Ministry of Health, for its collaborative work in facilitating this course, and not forgetting the aid that was provided by USAID. To you, the graduates, yes, you've completed the course. I want you to take this new knowledge, the zeal that you've gathered, especially as it relates to HIV, take it back to the area of work, your community. Help as much as you can. If you can, take some of the burden, the responsibility off the shoulder of NAPS, and help us to offer differentiated services towards the people living within our communities. And not only by helping us, we were able to actually bring a control and better attain our UNA targets, but also you would be setting and paving the way towards the elimination of HIV by 2030. Thank you.
Thank you very much, Tariq. I'll now invite Her Excellency Sarah Ann Lynch, Ambassador of the United States of America, to bring a few remarks.
Thank you so much, Dr. Adams. It's really a pleasure to be here today. Director of Pan-Caribbean Partnership Against HIV and AIDS, Pancap, Dr. Rosamond Adams, Honorable Minister of Health, Dr. Frank Anthony, Dr. Douglas Slater, Assistant Secretary General, Director of Human and Social Development, CARICOM Secretariat, Dr. Jagnarine, other esteemed guests, my own colleagues from USAID, members of the media, ladies and gentlemen, it's truly an honor, really, to be here today to witness the development of the healthcare sector in cooperation with the U.S. education institution. The USAID office in Jamaica was a sponsor of this certificate program and was proud to do so. And it worked with partners in CARICOM, the Ministry of Health, and healthcare providers at the National Care and Treatment Center, as well as St. Joseph's Hospital. So thank you to the University of Washington as well for your important part in training these important professionals in the healthcare industry. The partnerships of events like this are truly a testament to our common goal to improve healthcare and the health delivery systems for the benefit and prosperity for all Guyanese in Guyana. Our partnerships to specifically combat HIV/AIDS have been highlighted by the PEPFAR funding that has brought more than $185 million to Guyana since 2004. Through our partnership, Guyana has made significant strides in combating HIV/AIDS. And we were lucky enough this year to receive an extension, a 2-year extension to that program through the hard work of USAID and the Ministry of Health. And we're very happy about that to help Guyana further its accomplishments in this area. I was so pleased to hear of this particular training program for frontline workers who are so often overlooked as vital elements to a comprehensive healthcare system. I would like to thank all of you for taking up the challenge of fighting HIV/AIDS and having the vision of eradicating it in the coming years. The U.S. will certainly continue to work together to ensure that this is a reality for Guyana, and we will continue to do this in partnership with the ministry, with CARICOM, with the private sector, and it's really a pleasure to work with all these entities. What a great collaboration we have seen. So thank you so much for the invitation today. Congratulations to the graduates. Did I hear everyone had high grades? Very good. And everyone gets 12, is it? 12 continuing education units, which is fabulous. So that's always nice to get a certificate, but nice if you can use those units for further studies. And we hope that all of you do continue your studies. So congratulations again to all of you. Take care.
Thank you very much, Ambassador Lynch. And at this time, I'd like to invite Dr. Douglas Slater, Assistant Secretary General of the Directorate of Human and Social Development, CARICOM Secretariat, to bring remarks. And Dr. Slater is also representing our Secretary General, who unfortunately cannot be here with us this afternoon. Dr. Slater.
Thank you very much, Dr. Adams. Honorable Minister of Health, my dear friend, Minister Anthony, Excellency Ambassador Sarah Ann Lynch, Ambassador of the U.S. Ambassador to the Cooperative Republic of Guyana, representatives of the USAID, of Pancap and CARICOM Secretariat, and especially you, the graduates and the recipients of the certificates today, the media. When Dr. Adams came to me and briefed me on this, I was very pleased to know that despite the challenges we are all confronted with, that we can find the time and the effort to prioritize a still ongoing challenge, public health challenge. I felt very closely to it because some of you may know that I have been involved at the starting of Pancap and have been working with HIV since that's 20 plus years. And we discuss a lot about that. So The Pancap and the Ministry of Health and the US government must be applauded for this initiative. As I said, we have several problems, none the least being the COVID confronting our region. And to build capacity among our public health professionals shows that with these initiatives, show that we are very interested in protecting and maintaining the gains that we have made in the regional HIV response. So I wish to underscore the necessity of continued education, and I know you feel good about your 12 CME units. It is important. But it goes beyond that. You have some knowledge sharing, and Dr. Tariq before mentioned the importance of your role in sharing the knowledge, applying it to your work. Because we have to realize that we're working in a very strange environment now. But you know, it is said that never let a challenge go to waste. Make it an opportunity. So when you are dealing with the pandemic, use the opportunity to push the importance of maintaining the fight against HIV, and vice versa. So if you're going to engage persons with HIV, use that opportunity to let them know how important it is to be vaccinated. And I hope everybody here is pro-vax, even more so than I am. And if you can be more pro-vax than me, well then you're really good. I really want to challenge all of us here to understand the environment in which we're working. Our regional governments are pulling every effort to confront this pandemic. And excuse me if I go in that, but I think it's very important. And the governments must be supported by all of us. Because resources, I bring this in because we have to understand that there is a limit to the resources we have. And the more we have to use to fight the pandemic is the less you will get to fight HIV. So, you as frontline workers, we want you to do the best you can and continue to collaborate with Pancap, the Ministry of Health, and we are there as CARICOM Secretariat to assist where possible. I was pleased that the course content contains modules critical to the new thinking and innovative approaches for managing and treating HIV, and Dr. Tariq went into some of them. These including diagnosing HIV and initial evaluation of HIV-infected patients, an introduction of antiretroviral therapy, and HIV-associated malignancies and dermatology. So you had a wide exposure to various topics related to HIV. I applaud Pancap for the selection of the course that takes a holistic view of treating HIV. I was also pleased to see that the content included topics focused on opportunistic infections, and we don't have to go into details, but we know how that is important with dealing with HIV. And maybe we can consider COVID as one of them now. So that is important. Now, management of STIs in HIV patients was also touched, and that too is very important. Vertical transmission of HIV in pregnancy, etc. These areas are critical to creating practical roadmap for ending AIDS in our region, because you have to look at it holistically. Can't just, do it piecemeal and in a vertical way. Finally, I wish to applaud Pancap, USAID, and the Ministry of Health for providing an excellent example of how national efforts and the region can continue to progress despite challenges like COVID-19, and we have the ongoing challenges of the burden of NCDs and other issues. And by leveraging virtual learning platforms and online university courses, which we have spoken about before. The pandemic cannot and must not stop the progress if we take full advantages of the many opportunities for enhancing public health capacity, building in the virtual, on the virtual platforms. And that's one of the things. We have lost a lot from COVID, but it has made us more efficient in some ways. So, as I said before, we must not lose opportunities when there are challenges. Exploit them for what we can, and this is one way that we have been able to do so. So I want to also thank the University of Washington and to encourage Pancap to share this success story with the region, as many of our public health institutions as possible, as they continue to search for strategies and approaches for virtual learning. We want to also remember that one of the opportunities we got from the pandemic is to work from home. Now, it is an opportunity because it addresses some other social problems, but sometimes it has its limits too. So we hope that for those of you who will be receiving the certificates today, we really want to thank you, and we hope that this will be a shining beacon of the progress the region can achieve when we strategically collaborate and take full advantage of the fantastic opportunities of the virtual world. So again, on behalf of Secretary General Dr. Barnett, who is fully aware of this because just prior to coming here, I was in a meeting and I explained what is happening here, and she was very impressed and wished to convey her gratitude to Pancap, to the USAID and Ministry of Health for still being able to focus in on a public health challenge that can easily be pushed aside if we do not put in the efforts that all of you here have put in. So congratulations and thank you.
Thank you very much, Dr. Slater. And indeed, we did look for the opportunities in the pandemic to ensure that we continued with our training program. And we're very grateful to the University of Washington, who we worked with in order to roll it out as a pilot for us in Guyana. And we're hoping that over the years to come, we will roll this program out to other countries in the Caribbean region. We did have some good experiences doing it virtually, and so we're hopeful that we can also do this virtually across the Caribbean. At this time, we will hear reflections from two participants who have participated in the training. I'll welcome Dr. Mutu and then Dr. Jacobs to tell us about their experiences in the training. Dr. Mutu, welcome.
Thank you, Dr. Adams. Honorable Minister, Dr. Anthony, Your Excellency, Ambassador Lynch, Dr. Slater, Assistant Secretary General, CARICOM Secretariat, and Dr. Rosamond Adams, Director of Pancap, Dr. Jagnarine, and other esteemed members of the audience, and my fellow graduates. I am so happy to be here today, and I would first of all like to say thank you very much to Pancap, to the Ministry of Health, and to USAID for allowing us all to participate in this really very wonderful and very well put together program through the University of Washington. I'm especially grateful that the private sector, or the workers in the private sector, were included in this study. this opportunity to study and to learn. There were at least 3 of us, if not more, who were from the private sector, and I'm very glad and thank you very much for this opportunity. This was an extremely well put together course. It covered a very wide variety of topics. And it taught us, I think all of us, lots of different approaches to dealing with patients with HIV. For many of us, we have actually worked many years in HIV, so it was really refreshing to learn of different approaches. One of the things that stuck out in my mind was the approach of engaging your patient in their care, in helping them to choose a way forward for their care. I think back in the earlies, we had a kind of baton over the head approach of you do this or else. And now it's changed, and we were able to hear from experts, and experts who not only worked in resource-rich countries, but experts who worked in resource-limited settings similar to ours. And they were able to show us how you can engage your patient and how much better is the response that you get from the patient when you engage them in their care. And for us, I think at our site that we work at, we have tried to incorporate that in our patient care, and we have certainly seen a better outcome. Just in these few months, from April to now that we've been trying it, we've seen a really good outcome. One of the other things that I really enjoyed, and maybe it was because of the pandemic and we were all able to, no matter where we were, whether some of the colleagues were in the hinterland at the time or whether we were out of the country even, we were all able to get together at least once every 2 weeks virtually, discuss the modules that we had learned, ask questions, share experience. It really was such an invigorating time. It was really good. I thoroughly enjoyed that, and I thoroughly enjoyed hearing other colleagues' experiences when we got together. The last thing that I really appreciated with this course is that it, as everyone has mentioned, the wide variety of topics, the cutaneous manifestations of HIV, great in-depth training on STIs, all of which we have put to use in our clinic since we've learned about it. But I was especially grateful that there was a large section devoted to women's health. And I thought that that is something that we actually don't pay a lot of attention to individually. And it was really an eye-opener to see sometimes the disparity in care that is given to women, especially women of color in HIV. The way women are not necessarily included in studies, just lots of little things like that. Prevention was another great topic. So these were great eye-openers for us and great areas of discussion for us and things for us to think of as we go forward. Again, in closing, I'd like to thank you very much, Pancap, Ministry of Health, USAID, CARICOM, for allowing us this opportunity. Thank you.
Thank you, Dr. Motu. Dr. Jacobs.
Good afternoon, members of the head table, Honorable Minister Dr. Frank Anthony, Her Excellency Ms. Sarah Ann Lynch, Ambassador of the United States of America to the Cooperative Republic of Guyana, Dr. Slater, Assistant Secretary General, Directorate of Human and Social Development, CARICOM Secretariat, Dr. Rosamond Adams, Director of Pancap, honorable guests, participants of the course, congratulations to you all, members of the media. As the director of the National Care and Treatment Center, which is the largest STI/HIV site in Guyana, serving a population of approximately 3,000 HIV patients, and also being the main referral site in country, We take pride in our services that we offer to clients, and as such, we were privileged and honored that some of our senior physicians were actually a part of this training, hosted by the University of Washington, with the help of Pancap, the Ministry of Health, as well as USAID. We were able to have a glimpse of the U.S. management of patients living with HIV. We learned about innovative ways of managing patients, and we also got a chance to really put certain things in perspective and view things differently as we manage our patients. This course brought a further sense of satisfaction, knowing that we offer the best care available to our patients. We look forward to future opportunities in this career part. Collectively, I must say, the physicians love their jobs and they take pride in what they're doing. And it's very important that we can be able to have a positive impact on our patients who are HIV positive and be on the road in ending stigma and discrimination. One of the things that stood out to me as well as my colleagues during this course was the fact that we were able to learn about common mutations, and we understood how to actually make changes as it relates to HIV drugs. Sometimes I know it can be challenging for some physicians to know when to switch a patient from a particular regimen to another. Thank you. Once again, thank you to Pancap, the Ministry of Health, as well as USAID.
Thank you very much, Dr. Jacobs. So you've heard it from two participants, Dr. Mutu and Dr. Jacobs, on the value added from this training program. And we really encourage you to use the knowledge gained from this program and pass it on to your colleagues and really use it to improve the delivery of services in the national program. At this time, I would like to invite the Honorable Dr. Frank Anthony, Minister of Health, to bring some brief remarks. Minister Anthony.
Thank you very much, Dr. Adams, Her Excellency Ambassador Lynch, Dr. Douglas Slater, Assistant General Secretary, CARICOM, the representative from USAID, participants, media. It is hard coming after everybody would have spoken, I think. You know, Mark Twain once said, everything that had to be said was already said. But since nobody listens, you have to repeat it. So unfortunately, if I repeat some of what was said, you have to blame Mark Twain for that. But I just want to say that, first of all, I want to thank and congratulate Pancap and CARICOM for the work that they have done in organizing this particular training. I know they've been doing quite a lot in terms of knowledge sharing, but I think this one stood out, and the testimonies that we just heard points to the usefulness of this particular course. I also want to thank the US government and USAID for providing the resources and helping with the connections to get the University of Washington on board so that we can offer this training. And I think it's a step in the right direction where we can have these types of ongoing partnership. As was said already, I think the course, the content of the course for those who have been practicing, you know, you were able to get a refresher and to update your knowledge and maybe different ways of doing things. And for those who are now maybe joining the field of HIV medicine, that I'm sure you would have learned quite a lot, because from all that I understood, that the course was very comprehensive and dealt with a number of areas, a number of topics that would help in your day-to-day practice. We, of course, and I was very pleased to learn that one of the topics that you dealt with was things dealing with hepatitis B, hepatitis C. And I want to say to you that we are in the process of organizing right now a training program to train people in treating Hep C. And we are also going to get the manufacturers of the drug to come to Guyana maybe within the next month or so. And we are discussing with them to see how we can work on the elimination of Hep C. Many of you in your practice, you would recognize that there are patients with Hep C and you have difficulty sourcing the medicines for Hep C and also treating those patients. So we are hoping through this partnership that we'll be able to bring the people to do the training, get the medicines, and so that when you have such patients, we'll be able to treat those patients. So that's going to be adding to the knowledge that you have and practicing some of that. The other area that I want to talk briefly about is the whole area of vaccination. We have been working very hard to vaccinate our population. And as of yesterday, for first dose vaccines, we have 359,222 persons who got a first dose vaccine, the adult population. And for second dose, we have 199,978 persons that got a second dose vaccine. So for first dose adult, it's 70% of our adult population now would have gotten a COVID-19 vaccine. And for second dose, it's 39%. With the children, we have gotten, as you know, assistance from the US government, and we've been using the Pfizer vaccine for children between 12 and 18. And so for first dose, we've been able to administer 24,460 doses. That would account for 33.5% of that age cohort. And for second dose, we've completed 11,601 doses. So right now, we have 15.9% of that age cohort fully vaccinated. But here's the thing. The information on vaccination, we have a number of HIV patients who are eligible to receive a COVID-19 vaccine. Unfortunately, there is some kind of myth that permeates the community of HIV positive patients. Somehow they believe that they should not take the vaccine, and that has continued. And so I think there have been very, very low uptake with this cohort of patients. And in my mind, and in all the literature that I've seen, they are at risk. And therefore, having just graduated from this course, one of the things that I really want you to focus on is how can we encourage HIV patients to get a COVID-19 vaccine. If we are able to persuade them, we have to show them the pros and cons and make sure that they understand, and then encourage them to get the vaccine. Among the persons who have died at the hospital, I know that there was at least one case of a person who had HIV. And therefore, I think vaccination can help and will help these patients. So as we do this graduation here today, I think one of the take-home messages, how can you get involved in really encouraging patients to take the COVID-19 vaccine? And if we can turn that around, increase the uptake, I think our patients would really benefit from that. So that's a challenge here to you this afternoon. I want to congratulate all of you who took part in the course, and I'm sure as was said by Dr. Mutu, you're already putting that knowledge to use. So I wish you well, and I'm sure there'll be many more courses that we will organize, and I want you to be part of that as well. I think with a more educated, enlightened workforce, we'll be able to improve the quality of health care in our country. So I thank you so much, and I encourage you in future courses to participate. And you know, Ambassador, the 12 credits that they got, every year to get your license, you have to do 12 credits. So with one course, they got all the credits. Thank you. Congratulations.
Thank you very much, Minister Anthony. And I must say that Pancap has been listening to the people who live with HIV through our knowledge management work that we've done. We've had a number of webinars, a number of conversations with people living with HIV to find out what are some of the fears, what are some of the barriers to taking the vaccines. And we did listen to them. We did have a frank discussion with them through a webinar that we had, where we found it strange that people who have risk factors are saying that they're not taking the vaccines because of these risk factors, and had to really try to convince them that that is the reason why they should take the vaccine to protect themselves. But through our knowledge management work at Pancap, we will continue to encourage people living with HIV and with other underlying conditions to take the vaccines, and also to remind the participants of the charge from the minister that as you go out into your various practice to encourage people living with HIV, STIs, etc., to take the vaccine, those who are hesitant in doing so. So thank you very much, Minister. So we're moving right now into the awards of certificates, and I would like to invite Dr. Slater to assist us in handing out the first batch of certificates. Kailoti Das, Dr. Das. Yes. Not with us. Romina Donut. Keisha Chin. Javed Aziz. Thank you very much. Thank you, Dr. Slater. Minister Anthony, can I invite you to give the second batch of certificates? Dr. Abiola Jacobs. Julian Atkinson. Malaika Motu. Jillian Jardine. Faraz George. No, not with us. Okay. And Tiffany Niles. Thank you very much, Minister. Ambassador Lynch, may I invite you to present the next batch of certificates. Shanti Anthony Singh. Shanti is, all of you know Shanti is our knowledge management coordinator. Shanti has also been very instrumental in setting up this program. Unfortunately, she can't be with us today, so Minister will collect on her behalf. Tariq Jagnarain. Divya Shivas. And Dr. Shivas will collect on behalf of Dr. Branford, who is not with us. Lashmi Narayan. Dr. Shalon Bovel. We will also like to recognize the four coordinators who are very important in setting up, coordinating the site meetings, and also assisting participants as we walk through the program. Dr. Mutu Malaika. Shanti, Dr. Minister will collect on behalf of Shanti. Dr. Jagnarayan Tariq. And last but not least, myself, I was a coordinator and I also participated in the course. In order to coordinate, we had to participate in it. So it was indeed a pleasure working with all of you through the course. Thank you very much, Ambassador. Thanks, Dr. Slater. Thank you, Minister Anthony and Ambassador Lynch. And thanks to the participants. I'm sure that you're proud of yourselves. You're glad to see the beautiful certificates that you would have received this afternoon, and the accompanying 12 CME credits that you will also get to use for your registration. So, in closing, again, the charge from Minister Anthony, just to remind you, for all of us to continue doing our part, encouraging others to take the vaccine and to fight the issues around vaccine hesitancy, misinformation, etc. And as we walk towards improving HIV services. We know it can be difficult as we walk in the pandemic era, as Dr. Slater said. As the pandemic take more resources from us, this has the challenges of decreasing resources available for HIV. So we thank you very much for being part of this certificate award session this afternoon. Once again, Minister Anthony, thank you very much. Ambassador Lynch, Dr. Slater, we're glad to be graced by your presence, and to the participants and everyone, to Anita from the Pancap coordinating unit who have put everything together, to the staff from the CARICOM Secretariat who is doing the documentation, ensuring we get some visibility, to the Ministry of Health, and to all of you. We thank you. Please be safe, and we hope that, as we said, that you will use this information to improve the services that are offered here in Guyana, and to improve the lives of the people living with and impacted by HIV. So thank you very much, and good afternoon.